Hello, welcome to SSVF 300, Entry, Exit, and SSVF Assessment. I'm your trainer, HMIS Program Specialist, Cindy Flores. For the remainder of this webinar, we'll be working in Client Point module within Service Point. This is a section in Service Point where you will enter new clients and access existing client records. The focus of this training is how to collect data and document data into HMIS for rapid rehousing and homeless prevention. SSVF, Supportive Services for Veteran Families programs, provide homeless prevention and rapid rehousing services for singles and veterans and their families. Homeless prevention is a set of strategies to help low-income households resolve a housing crisis that would otherwise lead to homelessness. Rapid Rehousing is a program that provides financial assistance and services to prevent individuals and families from becoming homeless and help those who are experiencing homelessness to be quickly rehoused and stabilized. We will go step by step on how to correctly enter in a single or family into your project or grant and complete the Maricopa UDE assessment along with the SSVF program data elements on the SSVF entry assessment, which include income benefits, non-cash benefits, health insurance information, and veteran information. We will then work through how to complete the SSVF exit assessment, and we will also work through an example of a possible scenario that may occur. Please note, if you have any questions, feel free to contact us at the HMIS Help Desk via email at hmissupport@cir.org or by phone or text at 602-908-3605. Thank you, and let's get started. Once you log into the system, it will automatically take you to your homepage dashboard. If you work with multiple projects or grants, you will go to the top right-hand corner of the screen, locate the Enter Data As link, click on it, and once this pop-up appears, you will choose the project or grant you need to enter data into by clicking the green plus sign icon to the left of the project's name. Please do not use projects labeled program. These projects are for reporting purposes only and no client data is entered here. So for this scenario, I'm going to choose the VA SSVF Rapid Rehousing UMOM project, and I'm going to choose it by clicking the green plus sign icon. So as you can see to the top right hand corner, the project's name is automatically defaulted to the right of Enter Data As it should. Right underneath we have the Backdate module. This module will be used when entering client data that happened in the past, not today. For SSVF projects, you would use this module if you need to enter in client's information the day it actually happened. So I'm going to build a scenario. We're going to enter in a client and then exit a client. So I'm going to backdate to November 1st of 2015. So I'm going to clear out the date by using this blue circle arrow and add in November 1st of 2015. Please be sure that the time is set at PM, not AM. Then click the Set Backdate button and you will see that your banner turns yellow, and it will remain yellow while in backdate mode. Please be sure to note that the Data Quality Policy and Procedures says that all data must be entered within 5 business days. Next, go to the menu bar to the left-hand side of the screen and click on Client Point. The first step to take is to search your client, and you can search on this client search screen by either client's name, social security number, or if you have an existing client in HMIS, you would enter in the client's HMIS ID number right below here, where it says Client ID number. I have a brand new client, so I'm going to enter in my client's information, and I'm going to use a test client. Name SSVF last name test. Please keep in mind that providing identifying information is an SSVF eligibility requirement, and it is not optional. Then fill in the name data quality field. Here we have full name reported, partial street name or code name reported. This is used more for outreach teams. Client doesn't know, client refused, and data not collected. Please keep in mind, data not collected is considered the same as missing data. And it is also considered that the interviewer did not ask the question. So for this scenario, I'm going to use full name reported. Then we have alias. If your client identifies by two different names, you may put their second name in the text field box. Social Security number. For veterans, the Social Security number is relevant to eligibility. A veteran who declines to provide a Social Security number is not eligible for SSVF. So for this scenario, I'm going to create a fake social and then report the Social Security number data quality. And I'm going to choose full Social Security number reported. U.S. military veteran. This question is now answered on the client's search screen, and it should be yes for anyone who has ever been on active duty in the armed forces of the U.S., regardless of the discharge status and length of service. For SSVF projects, every adult must have a veteran status of either yes or no. Client doesn't know, nor client refused are permissible responses. This question can be answered on the client's profile screen, and I will show you what that looks like in just a few. So I'm going to answer this question yes. And right below we have the exact match box. Please do not ever click on the exact match box. It will not locate client names with misspellings. And we're building a search, so we want to make sure that we're not creating duplicate client profiles. So once you filled in all of the information, click the search button. If your client's name or the head of household's name populates below the client results, you can either click on the pencil icon or the name of the client after you verify that that is the actual client, and it will take you over to the client's record. I'm creating a brand new client, so you would always, for new clients, click the Add New Client with this information, and in the pop-up, press OK. After clicking OK, the system will automatically take you over to the Client's Profile tab. Within the Client's Profile tab, you can view the client's information. This is where you can access the U.S. military veteran question on the client's profile screen. And you can edit any of these fields by clicking the Edit Pencil icon to open it up, make any corrections, or answer any of these questions if they are missing. You also have the ability to upload a picture of your client by clicking the Change button right below and click the Choose File button and upload from your documents. You can add a description and click Upload to upload the picture. Right below we have the client demographics. This section will be blank the first time a client is entered into Service Point. Please do not ever use the Edit Pencil icon to the left of the client demographic to add or edit client information. This information will automatically fill in or change when an entry is created into your project through the Entry and Exit tab. Right below we have AZ Client Notes. This is a tool in the system used by some, but not all agencies, to create client progress notes. Client Notes is a generic notes section. Please do not use unless specified by your supervisor to do so. File Attachments. This is a tool that can be used to attach items such as birth certificates, identification cards, important documents, etc. to the client's profile page. And lastly, we have the incidents. This can be used to ban a client from your agency or certain areas within your facility and have staff have the ability to view this banned information at all times. So I'm going to scroll up so I can explain to you the rest of the tabs. To the right of the client's profile tab, we have the Households tab. Agencies serving families will use this tab to either create a new household or to update existing households. Agencies not serving families can skip this tab. To the right, we have the Entry and Exit tab. This captures when a client enters and exits a provider's project or grant. Case Managers tab. This is where staff can assign themselves as a client's case manager electronically. You can learn more about this feature in Case Management 200 training series. To the right, we have Case Plans. This is where goals can be set for clients. Again, you can learn more about this feature in the Case Management 200 training. Then we have the Measurements tab. This tab is not seen by all users. In the Maricopa County, it is where you can find additional measurement tools for collection of data like the SPDAT or FSPDAT. Only approved users have access to this tab. And lastly, we have the Service Transactions tab. This is where all referrals and services can be recorded and viewed along with the client's shelter stays if your client uses the Shelter Point module. You can learn more about this feature in Case Management 201 for services, and if you would like to know more about referrals, you can take the Case Management 202 class. To get out of this section and to go over to the other tabs, you would always click on the Client Information tab. Next, I will show you how to create a household. Go over to the Households tab. From the Head of Households record, you will go over to the Households tab and create a household. If you're entering a single individual into your project, you can skip the Households tab and go straight to the Entry and Exit tab. If the head of household has a household created, please use that household grouping. Do not create another household. If the household composition changes, please do not create another household. Use the household. You can exclude household members by not checking them into your project. I will demonstrate how to do that later in the video. Please do not remove or delete a household member from a household grouping unless that person is deceased. Before creating an entry into your project, you must first create a household. Since my head of household does not have an established household, I will create a brand new household. So click on Start New Household. The first thing you have to do is determine what type of household it is. So up at the very top in this window, click on the household type pick list. A definition of household types can be provided by the HMIS team. I'm just going to define two of these household types. Couple, parent and friend, and child or children. This is to be used when adults are not married and there are no biological shared children. Two parents with child or children. This is to be used when the adults are either married or there is at least one biological shared child in the family. For this scenario, I'm going to use single parent with a child. In the client search, I'm going to create the client's information. So I'm going to name my child. Then you have to answer the name data quality. I'm going to put in full. I'm going to create a fake social for this scenario and report the Social Security number data quality as full. And the U.S. military veteran question does not have to be answered on children 18 and under. Then click Search. If your household member already has an existing profile within HMIS, the client's information will default down here in the Client Results section. You can add the household member by clicking the green plus sign icon. But if you're working with a brand new client, click the Add New Client with this information button, then press OK. So either way, your client should appear below the Selected Clients section. You can repeat the steps above to find and add new client members until everyone in the family who is entering your project is listed under the Selected Clients section. So once you have added all the household members, click Continue. On the second screen, you will then establish which household member is the head of household by using the drop-down by changing the no to yes for the head of household. As you can see to the right, the relationship to the head of household for the head of household automatically defaults to self. Please leave it at self. Do not determine who they are in the family, whether they're mom, dad, grandma, grandpa. Then for the child or the additional household member, you would just determine the relationship to the head of household from this pick list. So I'm going to choose son. The joined household date should be the entry date or before if the household was previously established. This date should never be after the entry date. And if you needed to change this date, you can just manually change it. Once all the information is complete, click Save and Exit. So this is how the screen would look like if there was an established household created, as we just created a new household. So if you need to manage the household, you would just click the Manage Household button and it'll take you over to the same screens and just make the necessary corrections or add a new household member. But please make sure to never delete a household member unless they are deceased. So now that I have my household updated, I'm going to go over to the Entry and Exit tab and enter in my family into my project. You would always do entries through the head of household's client's record, not their own record. So on the Entry and Exit tab, click the Add Entry and Exit button. And this pop-up comes up. This household members section is the household's family grouping, and you would check in the household member who is going into the project with the head of household. Now, if you have a household grouping with a person that is not entering your project, please do not check their name. Only check the individuals who are going into the project. In this section, the entry data section, please make sure the provider is a correct provider. If you don't have the correct provider listed here in this pick list, cancel this transaction, go to the top right hand corner and click on the Enter Data as link and choose the appropriate project. The type is always going to be VA, and please ensure that the entry date is the correct date. If it's not the correct date, cancel this transaction, go to the top right hand corner and backdate to the appropriate date. So once you've verified all the information, click Save and Continue. So we have this window here. We have the household members associated with this entry and exit. Select an assessment or all the available assessments you have, and then the assessments itself. And here to the left we have the household members. So you can switch so you can fill out the appropriate assessments, and I'll show you how to do that in just a few. So the Maricopa UDE assessment automatically defaults for the head of household first. So we're going to go ahead and fill out this Maricopa UDE together. Date of birth. So I'm going to go ahead and make up a date of birth for this scenario. Then answer the date of birth type. I'm going to report it as full DOB reported. Then we have primary race. Specify from the 5 listed races which is a primary race of your client. This question has detailed information on how HUD defines these races if you hover your cursor over the question. So as you can see are the definitions for those races. So for my client, I'm going to report my client's race to be white. If your client reports to be biracial, please report the secondary race here, but do not duplicate the secondary race. Ethnicity. Specify if your client is either Hispanic or non-Hispanic as defined by HUD. If someone reports to be only Hispanic or Latino descent, their primary race is white, their ethnicity is Hispanic. I'm going to choose non-Hispanic for my client. Then we have gender. Specify the gender of your client. If they report something other than what is listed here, these 4 listed here, then you would choose other, and right underneath we have a text field box. If other gender specify, and you would report what they say. And remember, this is self-reporting information. So I'm going to choose my client's gender to be male. Then we have, does the client have a disabling condition question? Choose yes or no whether your client has a reported disability. There is additional information about HUD's definition of disability. If you hover over the question, it gives you the full definition. We also have a handout for documenting disabilities upon request. So I'm going to say yes for this question. Residents prior to project entry. From this pick list, you would report that residents or non-residents your client slept last night. This is a comprehensive list, but if they reported something that is not on the drop-down, then you would choose other, go to the next question, and specify the other type of residence they stayed at in the text field. So here we have emergency shelter, foster care home, hospital, hotel, jail, long-term care facility, owned by client, no ongoing housing subsidy, with ongoing housing subsidy, permanent housing for formerly homeless persons, which is permanent supportive housing, place not meant for habitation. Client either slept outside, in a car, in an abandoned building, campground, or any similar place not meant for habitation place. Psychiatric hospital, rental by client, no ongoing housing subsidy, with VASH subsidy, which stands for Veterans Affairs Supportive Housing, with GPD TIP subsidy, which stands for Grant Per Diem Transition in Place, and it is usually a veteran project. With other ongoing housing subsidy, this can be like Section 8, residential project or halfway house, and then we have Safe Haven. Safe Haven is a transitional housing for people with serious mental illness. If you scroll down, there is some additional options. We have staying or living with a family member or friend, substance abuse treatment facility, transitional housing, other client does no client refused, and data not collected. So for this scenario, I'm going to choose place not meant for habitation. Then we have the length of stay in previous place question. This question relates to the above question. residence prior to project entry. How long did they stay in the residence reported above? We have 1 day or less, 2 days to 1 week, more than 1 week but less than 1 month, 1 to 3 months, more than 3 months but less than 1 year, 1 year or longer. For this scenario, I'm going to choose 1 year or longer. Then we have zip code of last permanent address. Specify the 5-digit zip code of the last place the client was housed for at least 90 days. If the client cannot remember the exact zip code, then please ask which city they lived in and use the zip code list to complete the question. So if you hover over the question, it gives you a cheat sheet of the zip codes in those cities, and then a generic zip code for outside of the county and then outside of the state. So I'm going to fill in zip code. Then we have relationship to the head of household. For the head of household, you're always going to report self, and for singles, you're always going to report self. Then we have a client location. This is the Maricopa County Continuum of Care Code. There's only one option to choose from, and it is AZ502 in the drop-down menu. Please make sure to choose it to complete this question. Homelessness primary reason. Specify the primary reason the client reports for their homelessness. If you are entering under the Homeless Prevention Project, you would choose client not homeless. But I'm working under the SSVF project, so I'm going to choose economic for this scenario. Then we have these next set of questions for length of time on street, in an emergency shelter, or safe haven. These set of questions, along with other questions in the assessment, will help determine if your client is chronically homeless. Please ask these questions on all heads of households and adults. The first question. Client entering from the streets, ES or SH? Answer yes if the client is entering your project directly from a place non-member habitation and an emergency shelter or a safe haven. Answer no if the client is entering your project from any other location. Diversion and homeless prevention should choose no. So for the scenario that we built above, I'm going to say yes to this question. If your client is coming from streets ES or SH, you should have the client look back to the last time the client was not on the streets ES or SH to answer the second question. If yes, client entering from streets ES or SH, approximate date started. So I'm going to give you guidelines, rules to help answer these questions. If there was a break in their time on streets ES or SH of less than 7 nights, do not count it as a break. It would be one continuous episode of homelessness. If the client experienced a break for more than 7 nights, count a break in between episodes. If a break in time was 90 days or less due to an institutional stay such as jail, substance abuse, or mental health treatment facility, hospital, or other similar facilities, that time should be included in the start date time. If the client was at an institutional stay for longer than 90 days, they are considered housed. If the client knows the month that the homelessness started but not the exact day, use the day they are entering your project with the month and year they reported. Documented stays in HMIS may be used to jog the memory of the client, but cannot be substituted for information provided directly by the client. If the answer above was no, then leave this question blank. So for this question, I'm going to document the start date time of 2/28/2013. Then the next question. regardless of where they stayed last night, number of times the client has been on the streets, NES or SH in the past 3 years, including today. Record the appropriate answer for the number of times homeless experienced in the last 3 years for any combination of place nonmember habitation, emergency shelter, or safe haven. When counting episodes, please use the guidelines rules that were explained in the previous question. If yes, approximate date started. Never in the past 3 years should be used for diversion or homeless prevention projects. So from this pick list, we have 1 time, 2 times, 3 times, 4 or more times. I'm going to say for this scenario it was 4 or more times. Total number of months homeless on streets, NES or SH in the past 3 years. Count the accumulated number of months the client was homeless and residing in one or any combination of those 3 locations in the past 3 years. Please note, any single day or part of a month spent should count as 1 full month. So for this scenario, I'm going to choose more than 12 months, but we have the options to choose from 1 month, this is the first time, to 2 to 12, then more than 12 months. Length of time homeless status documented. Indicate if there is documentation of the client's length of homelessness, either in the client's paper file or in HMIS for either number of times homeless or number of months homeless in the past 3 years. So I'm going to say yes for this scenario. If you're working with a single, you would click the Save button and then scroll all the way to the top and locate the SSVF entry assessment in the Select an Assessment section. Click on the SSVF, so then we would click Save and scroll up to Select an Assessment, and since I'm working with the head of household, I'm going to switch assessments and answer the second assessment, the SSVF entry assessment. So the first part of this assessment is a universal data elements, which is the Maricopa UDE assessment. So automatically default all of these questions over. So then all you have to do is answer the SSVF program data elements section. So the first question, total monthly income. This is a text field, so you would type in the client's total monthly income. If the client has no income, you'd have to put in a total of $0. If the client has more than one source of income, please add them together and put in the sum in this field. So I'm going to build a scenario of a client coming to my project with no income. So income from any source, I'm going to answer this question, no. And within the sub-assessment, and this is a sub-assessment, you would click on the HUD verification, because HUD wants you to ask from the list of sources they consider to be income. They don't want you to ask your client what kind of income you're receiving, because they may not consider some of these sources actual income. So this HUD verification is required by all the federal partners, including the VA. So you have to answer this HUD verification questions. So if you know right off the bat that your client is not receiving any income, you would answer the radio button question, no. But if your client was actually receiving income, for example, earned income, you would use the shortcut, answer everything no, and then change the no to yes for the actual income. And you would put in the monthly amount here, and then click Save. How to change an income and when a client is employed will be covered in the SSVF 301 class. So I'm going to click cancel and yes to the question to cancel, and then save and exit. Sorry, I have to answer this question as well. Didn't see it there, but you would answer once everything is complete, click save and exit. And once you've answered all of the questions through the HUD verification, you will get a green check mark to the left of the HUD, to the right of the HUD verification link. And as you can see, the HUD verification created a timestamp of all of the listed sources in the sub-assessment. And this should only be answered once, and it should be at entry. So just to double check you filled out all the information correctly, you can click this View Gross Income button, and it will give you the monthly and the annual amount. So scroll down and locate the non-cash benefits from any source. Choose yes or no to whether the client is currently receiving any form of non-cash benefits at entry into your project. So I'm going to say no for this scenario. Go through the HUD verification. Say no to everything by using the radio button as a shortcut, and then save and exit. Now let's go over and answer the covered by health insurance question. Choose yes or no whether the client is currently has any form of health insurance at entry into your project. Use the HUD verification. So I'm going to answer no. Go through the HUD verification. Answer yes or no to every source of health insurance on the list. Please keep in mind that access is considered Medicaid. The shortcut would be to answer everything no at the top radio button, and then change the no to yes for any of the receiving benefits. So once information is filled out, click the Save and Exit button. Then we have the highest level of education attained. Choose from the drop-down list the highest level of education the client has attained. So I'm going to choose Associate's degree. Then we have the in-permanent housing question, yes or no. This is initially collected at project entry. The response at the time will typically be no unless your project is able to move participants into permanent housing on the very first day in program. So I'm going to answer this question no. But if yes, date of move-in. The move-in date is for RRH clients, Rapid Rehousing. When in permanent housing is yes, you will be asked to enter the date of move-in. This should be the date during enrollment that the participants moved into permanent housing. Client entered into RRH once they determine eligibility, but it often takes a few weeks to find an apartment and get moved in. Once the client moves in, then an interim update will be done to document the actual move-in date, and this will be covered in the SSVF 301 class. In most cases, this question at entry will be answered no because it takes a few weeks for the client to move into an apartment. Then we have the veteran information. Click the Add button inside the sub-assessment. Then you have to answer all of these questions. And a guide is available upon request for this section. Year entered military service and year separated from the military service. There are a few guides to this question. So record the year entered and year separated for the veteran's longest continued continuous period of service. If two continuous periods of service are identical in length, and one was during a combat era and the other one was not, record the year entered and year separated for the combat era period of service. If two continuous periods of service are identical in length, and neither or both were during a combat era, record the year entered and year separated for the most recent period of service. So I'm going to change these dates to fictitious dates, of course, because this is training. Then below we have the theater of operations. Identify whether or not the veteran served in the theater of operations for any of the listed military conflicts. Only physical presence within the geographical area during the conflict is required for a yes response. This is not a question of whether or not the veteran was in combat or ever came under fire. Answer no if the client did not serve. Do not leave these questions blank. So you have to answer each and every question. So we have World War I, Korean, Vietnam War, Persian Gulf War, Afghanistan, Iraqi Freedom, or Iraqi Dawn. Other peacekeeping operations or military conflicts. From this pick list, choose yes or no. Then we have the branch of the military service. So record the branch of the military in which the veteran served the longest period of time. If the periods of service are identical in length, please see the instructions from the year entered military service and year separated from military service. So from this pick list, I'm going to choose Marines. But we have the options of Army, Air Force, Navy, Marines, and Coast Guards. Answer the discharge status question. Record the veteran's discharge status. For veterans with multiple discharge statuses, under different conditions, record the best discharge status. So I'm going to choose from this pick list, honorable. But of course you have the option to choose from general, under honorable conditions, under other honorable conditions, bad conduct, dishonorable, uncharacterized. Once all of these questions are filled in, click the Save button. Then we have the percentage of AMI. This is used to indicate if the household's income is less than 30%, 30 to 50%, or greater than 50%. I'm going to choose less than 30%. Then we have the last permanent address. In the sub-assessment, click the Add button to answer these questions. So where the client was housed for 90 days or more. This should be answered on head of household and adults. Addresses of emergency shelters should not be recorded here. You can leave the start date defaulted as is. But the questions that are required is the client's street address. So I'm going to use 2200 North Central Ave. If it's an apartment, please document the apartment number, the city, the state, and the zip code. Also required is the address data quality. From this pick list, we have full address reported, incomplete, or estimated address reported. I'm going to choose full. If you have any of these other questions, if you have the information, please record it. But these is the required questions that you have to answer. Then click Save once you're done. These next set of questions are required to be answered upon project entry for the SSVF data export. So here we have the HP screening score. Record the 2-digit integer number of the head of household. SSVF grantees must enter the information for the homeless prevention threshold score for each at-risk household served in the project. You may leave this question blank if you are serving a Rapid Rehousing client. So I'm going to leave this blank because I am actually working under Rapid Rehousing. The next question, VAMC station number. Record up to 8 characters. This is required for the head of household. The VA will provide the SSVF grantees with the VA medical station number that corresponds to their service location. So I'm going to report 345. So at this point, if you're working with a single, you would be done. You would click Save and Exit. But since I have a household member, I'm just going to click Save. Scroll all the way to the top. Go back to the Maricopa UDE assessment, and then click on the child's name. The children's entry assessment requires less data to be filled in than the adults. The SSVF assessment question handout is in your confirmation email, and this cheat sheet tells you which questions to answer on the type of client, whether it's head of household, adults, or children. The Maricopa UDE assessment is the first assessment to fill out. So I'm going to go through the required questions only. So record the date of birth. So I'm going to record a fake date of birth for my client for this scenario. Record the date of birth type. I'm going to report full name reported. The primary race. I'm going to make it the same race as the head of household. And the ethnicity as well. Have to answer the gender and the relationship to the head of household. So from this pick list, we have self, which would never be self for the additional household member, head of household's child, head of household's spouse or partner, or head of household's other relation member. So I'm going to choose head of household's child, and then click Save. So in the Maricopa UDE assessment, these are the only required questions. Then switch over to the SSVF entry assessment. Scroll down to the SSVF program data elements. You have to answer the covered by health insurance question. So I'm going to answer this question no. Go through the HUD verification. Answer everything no at the top radio button, and then it automatically does it for you. Once everything is filled out, click Save and Exit. And then the other question that has to be answered is in permanent housing. So this is upon entry, so I'm going to answer this question no, because I answered the head of households in permanent housing question no as well. So once those questions are answered, click Save and Exit. So then it takes you over to the Entry and Exit Preview pane. We entered in our Rapid Rehousing client under the VA SSVF Rapid Rehousing, UMOM, the type VA entry 11115, and the client count. If you click on this magnifying glass, it gives you the household members included in the entry and exit. I'm going to click Exit to get out of the pop-up. So now I'm going to exit the client. I'm going to say a couple of months have passed and my client is ready to be exited from my project. I'm going to say that my client exited as of today's date, so we'll go ahead and get out of backdate mode by clicking the X to the right of the full date up at the top right hand corner. So I'm using a shortcut I'm using a short time for training, but some clients may stay for a longer period of time because they need to be stabilized. So I'm going to go over to the client's point and search for your client through the client search by either name, social, or HMIS ID number. So I have my client's name, then click search and locate your client under the client results section, and you can click on the pencil or the name of the client to go to the client's profile. So once you do, to exit the client, you have to go to the Entry and Exit tab and click on the Entry and Exit pencil icon. And remember, you have to record entries and exits through the head of household's record, not their own record. So if you're working with a family, under the Household Members section, please check every family member's name that is leaving with the head of household. Do not leave children into your project without an adult. So I'm going to check my child in. Then we have the exit date. Please be sure it's the correct date and answer the reason for leaving question. So why did my client leave my project? Was it because they completed the program? Was it criminal activity, death, disagreement with rules, diverted from homeless services, left for housing opportunity before completing program, needs could not be met, non-compliance with program, or non-payment of rent? I'm going to say for this scenario, they completed the program. If there was another reason, you would choose other from the pick list and specify what that reason is. Then the destination. Where will my client be going to? The VA considers client doesn't know, client refused, or data not collected as missing information, and this may count against you on your data quality reports. You should always strive to input a real destination whenever possible. So this pick list looks similar to the residence prior to project entry. So I'm not going to go through every single destination, but I am going to go over the ones that appear at exit only. So we have deceased, move from one HOPWA funded project to another HOPWA PH, and HOPWA stands for Housing Opportunity for People, for Persons with AIDS. PH stands for Permanent Housing. TH stands for Transitional Housing. Then we have staying or living with family, permanent tenure, and temporary tenure. There's no solid HUD guidelines to this, to what permanent and temporary is, so you can use what we use. We say permanent for a person being housed for more than 2 years, and temporary being anything less than 2 years. So for this scenario, I'm going to choose rental by client with VASH subsidy. Right underneath we have this notes section. You can put in notes if you like in here. And then once everything is filled out, click Save and Continue. Depending on your workflow, your exit assessment may be different, but in most cases it's going to be the SSVF exit assessment. Then scroll all the way down. Then we have these 2 questions here. And this is required to be answered for the homeless prevention projects only. I'm working under the Rapid Rehousing project, so I'm not going to answer these questions, but I am going to explain them. Household at exit. So was your client able to maintain the housing they had at project entry? Did they move to a new housing unit, moved in with family or friends on a temporary or permanent basis, moved to a transitional or temporary facility or program? Did the client become homeless, moved to a shelter or other place unfit for human habitation? Client went to jail, client died, client does no, client refused, or data not collected. So if your client was able to maintain housing at entry, what kind of subsidy did they receive? Was it without subsidy, with subsidy they had at project entry, with ongoing subsidy acquired since project entry, only with financial assistance other than subsidy? And then if you chose, if moved to new housing unit, subsidy information, with ongoing housing, with ongoing subsidy, or without ongoing subsidy. So you'd answer these questions only if you were working under the Homeless Prevention Project. So once all the information is filled out, click Save and Exit. Once you save and exit, it will automatically take you over to your Entry and Exit Preview pane. You will then see your project's name, date of entry, exit, and then the client count. So we're almost done. All is left is to go over some key points, and I will explain to them in the summary. According to Maricopa HMIS Data Quality Plan, you must enter clients into the system within 5 business days. The U.S. military veteran question is initially answered on the client search screen, but it can also be answered on the client's profile screen. When creating a household, you must go through the Households tab. There can only be one designated person as the head of household, and it must be the veteran for SSVF projects. When creating an entry, you must go through the Entry and Exit tab. Client demographic information should always be recorded on the Entry and Exit tab through the Maricopa UDE assessment. HUD considers zip code of last permanent address or last permanent address to be where the client was housed for 90 days or more. Remember these points when completing the length of time on street in an emergency shelter or safe haven section. Only answer yes to the first question when the client is entering your project directly from the streets and an emergency shelter or safe haven. The exception is if they were in an institutional setting for less than 90 days and came from one of those locations just before being institutionalized. When entering the date the client's current episode of homelessness started, you may use their current entry day into your project. But if they cannot remember the exact day, for example, if their entry date to your project was 10/3 of 2015, but they can only remember the last episode of homelessness starting in May sometime, then you can put in a start date of 5/3/2015. Count the number of times the client has been homeless in the past 3 years, even if they are not entering your project directly from streets, emergency shelter, or safe haven. Only use never in the past 3 years for diversion or homeless prevention, because the question says to include today as an episode. Add up the accumulated months of homelessness during the past 3 years where the client was either in the streets, in an emergency shelter, or safe haven. Any single day or part of a month counts as one full month for this question. If a client enters with no income, put in a 0 in the total monthly income text field. In the state of Arizona, access is considered Medicaid. When completing the veteran information section, please remember that the year entered military service should be the actual date. At least a month or year is fine. They entered the service and not their entry date into your project. All questions in the veteran information section should be completed. Please answer either yes or no for each theater of operation listed. Percentage of AMI must be answered for the veteran or head of household using these ranges: greater than 50%, 30 to 50%, or less than 30%. The HP screening score applies to homeless prevention projects only. It should be a 2-digit integer. The VAMC station number applies to all SSVF households. It should be 8 or less characters. When creating an exit, be sure to go through the Entry and Exit tab and use the Edit Exit pencil icon to exit your client or family from your project. When working with the homeless prevention client or family, be sure to answer the Housing Assessment at Exit question on everyone in the household. By following these steps and working through the system, you have completed SSVF 300 Entry and Exit SSVF assessment. As a reminder, if you have any questions, feel free to contact us at the HMIS Help Desk via email at hmissupport@cir.org or by phone or text at 602-908-3605. Thank you, and please refer back to your training confirmation email for further instructions.